When I was 16, I actually started off with knee pain. So I went to see my first orthopedic surgeon, and it was just for my knee because that's what I thought what the problem was. He was like, no, it's definitely your hips. So my surgeon actually knew of Santore and was like, here, I'm gonna send you to this guy that's really good and he knows what he's talking about and he's gonna look at your hips. And I was like, okay, like sounds good. So that's when I saw Dr. Santore.
PAO is an abbreviation for periacetabular osteotomy, and that surgery is indicated in individuals with hip dysplasia who have pain during activities of daily living and athletics. Sometimes it can reach levels of totally disabling pain that simply ruins their lives prior to the surgery.
So he came in and he was like, you have a hip dysplasia, you have a labrum tear, and so I want to set up surgery.
Well, in very simple terms, the hip joint is made of a socket and a ball, and the socket is part of the pelvis. In a periacetabular osteotomy, we take the socket and detach it from the pelvis so that we can mobilize it in 3 dimensions and improve its position, which alters the mechanics of the hip in a very favorable way, and in most cases completely eliminates the pain. McKenzie's operation took place in February of 2019, and at that time it was a very unusual step to do a PAO as an outpatient, and we proceeded cautiously with carefully selected patients. It's been an amazing evolution of pain management and rapid rehabilitation protocol coming together to allow this to be possible. We've borrowed a lot of the techniques that we use in our total hip and total knee patients for complete pain relief on the day of surgery and have adapted them to the hip preservation surgery very successfully. So it's unusual for any patient to wake up from anesthesia with any pain at all now.